Welcome to our webinar, Glaucoma Wellness Tips for Vision and Health. My name is Brizette Castellanos, and I am the Digital Media and Engagement Manager at Glaucoma Research Foundation. As you've probably heard, January is National Glaucoma Awareness Month. It is a good time to talk about the sight-stealing disease and raise awareness about the importance of regular eye examinations to preserve vision. So talk to your family and friends about glaucoma. Do your part and help us spread the word. In honor of National Glaucoma Awareness Month, we have launched a second annual Faces of Glaucoma campaign and fundraising challenge. This campaign showcases the diverse stories of glaucoma patients, educational resources, and empowers others to take care of their eye health. Join the Faces of Glaucoma fundraising challenge and help us reach our goal of raising $40,000 for sight-saving research. I'd like to take a moment to thank Bausch & Lomb for their partnership in our special Faces of Glaucoma campaign and their continued support of glaucoma patients everywhere. During the month of January, Bausch & Lomb will match every gift made to Glaucoma Research Foundation up to $20,000. So if you donate today, your impact will be doubled. Joining us today is Dr. Leonard Seibold. Dr. Seibold is a professor of ophthalmology at the University of Colorado School of Medicine. He specializes in medical and surgical treatments of cataracts and glaucoma and also serves as the Glaucoma Fellowship Director at the University of Colorado. His research interests include ocular imaging, surgical treatment of glaucoma, and 24-hour intraocular pressure monitoring. After Dr. Seibold's presentation, we will be joined by two glaucoma patients for the Q&A portion of the program. Jerrold Keilson was diagnosed with glaucoma almost 20 years ago and has maintained an active lifestyle, including biking and weightlifting. He has also continued his professional career managing overseas development projects. He is currently collaborating with organizations in Africa, supporting individuals with vision loss challenges. We will also be joined by Alice Burnett. Alice has dedicated 37 years to the Trenton Board of Education as a library media specialist for grades 6 through 12, retiring in 2017. Diagnosed with glaucoma in her early 30s, Alice has managed the condition alongside her doctors and is now partially sighted. She is an active member of the Mercer County Association of the Blind and Low Vision and the New Jersey Council of the Blind and Low Vision. We will now hear from Dr. Seibold.
Thanks, Brizette, and thanks to you and Michelle and the Glaucoma Research Foundation for the invitation to be here and to speak with you today. It's really an honor, and hopefully this will be helpful to all of you listening and watching, and I look forward to hearing from our other guest speakers and then to some Q&A later in the webinar. I think this is a topic that generates a lot of interest. I know from my own patients, this is a topic that comes up a lot, and you can see that from the subtitle. That's a question that I get asked all the time. Isn't there something else that I can do for my glaucoma? And so we're going to focus on these different modifications or what I like to call complementary things that we can do to help with your glaucoma or has the potential to help. These are my financial disclosures. None of these are relevant to the current topic. So as most of you probably are all too aware of, in glaucoma, it's all about the IOP, the eye pressure or intraocular pressure. You probably hear about this every visit with your doctor, and it's for good reason. It's the only modifiable risk factor that we have for this disease. Most of my colleagues in retina and cornea, my other specialist colleagues, they all say we have a one-track mind. You know, we're always focused on pressure, and you probably feel that way as well. But every treatment goal that we set for glaucoma is related to IOP, to that eye pressure. All the therapies that we do, whether it's eye drops, whether it's surgery, laser surgeries, they're all trying to lower intraocular pressure. But despite lowering eye pressure as well as we can, we still see that glaucoma progression can happen. So the disease can still get worse. This is just an example of a patient of mine who had excellent pressures. You can see on the left-hand side there, her pressures in clinic were never above 10, between 7 and 10, about as low as we can get them safely. But the OCT scan here showed, you could see this red highlighting that the thickness of her optic nerve was getting worse. And the visual field from left to right, you can see how that blind spot right near the center of her vision was actually enlarging despite having these great pressures. So there's clearly other things that happen in glaucoma that aren't related to eye pressure that we don't really fully understand, but that gives us a window of other opportunities for us to explore complementary therapies as well. And as I said, when your doctor's coming across with the slit lamp to measure your pressure one more time, this is always the question that comes up. Isn't there something else we can do besides focusing on pressure all the time? And the trends have shown that people are interested in complementary health approaches. This is from the NIH data. This is for all types of illnesses, but you could see back in 2002, so over 20 years ago, only 19% of patients were engaged in some type of complementary health approach, whether that was acupuncture, yoga, meditation, something like this, where 20 years later, now in 2022, almost a doubling of this. So over 1 in 3 patients are engaged in some type of complementary health approach. So clearly this is something of interest. I want to emphasize one thing with before we get started on this with regard to lifestyle modifications. These should be seen as complementary and not alternative. I think this is where these approaches get sort of a bad name when you consider it alternative. So when you really buck the trend and say, I don't want to lower my eye pressure, or I don't want to take traditional therapies, I want to go completely only with these as an alternative. I don't think that's the right approach. I think we should look at these as complementary, where our traditional treatments focused on eye pressure are certainly the tried and true way, best way to manage this disease, but these can be seen as potentially complementary to our traditional treatments. There's a number of problems and limitations, as you'll see with a lot of these modifications, and I want to touch on this first too. Most of the studies looking at these are involving pretty small study sizes, so maybe anywhere from 5 to 20 patients, and it's hard to really make sweeping changes in how we treat a disease based on a small study like that. A lot of them were only followed for a short period, maybe 2 weeks to a couple months. Again, this is a lifelong disease. We don't have a cure, unfortunately, and so we need longer follow-up to really have a lot more confidence in these things. Most of the studies, although they may show an improvement or an effect of some kind, it's usually a very mild effect. And you have to remember that most of these patients were also taking their traditional eye drop therapy or had surgery or had laser treatment alongside of it. So it's hard to say exactly how much the exact effect of these complementary approaches would be. And a lot of times there's conflicting results. So one study may show that something helped, another one may show that it actually hurt, some others may show no effect. So you have to keep that in mind as well. And when we talk about supplements, remember the FDA doesn't approve supplements to treat any disease. They're only responsible for the consistent manufacturing of them and making sure that they have the ingredient that they say in them, but they don't approve them to treat the disease of any kind. But ultimately, we need better studies, larger data sets to prove that these things can have a long-term benefit for eyes that have glaucoma, the way we know that lowering intraocular pressure has. So the first topic is aerobic exercise. This, I think, is a great one because the most common answer I give to my patients when they ask me, what can I do outside of eye drops to help my glaucoma? And I usually say, whatever's good for your body is usually good for your eyes. And I think exercise is a great example of this. This could be walking, running, swimming, cycling, any type of aerobic exercise. We know that there's a short-term effect from this. So while you're doing the activity, whether whatever it may be, you actually have an increase, a small increase in your eye pressure during that activity. But immediately after, you have a drop in your eye pressure, about 2 to 3 points or 2 to 3 millimeters of mercury. And this can last for 30 minutes up to 2 hours, depending on which study you're looking at. But the long-term effects are what really, I think, can have some benefits. So some studies have shown that the more daily steps you take, the slower the rate of your visual field decline can be. So the slower that the glaucoma will progress, the more steps that you take. Another study found that if you did just 10 minutes of exercise every day, you had an 85% lower odds of having your visual field worsen or losing more peripheral vision. Another study, a few studies actually have shown that the more physical activity that a patient engaged in, the less severe their glaucoma was. So their disease in general was less severe the more active they were. And another study, which I think was most impactful to me, was when they took patients who were relatively sedentary, had no routine exercise regimen at all, and they instituted about a 4-time-a-day exercise routine. They lowered their pressure on average almost 5 points, 4.6 millimeters of mercury on average, which really, I think, for me, showed me the long-term benefit of aerobic exercise. So I think combining this with the overall health benefits of exercise, as long as it's safe to do, you don't have any other physical conditions that may limit you from doing this, I think it's great to recommend this for anyone who has glaucoma. Now, there's specific types of exercise as well that I want to touch on. The other types of anaerobic exercise, like weight training or resistance training, they also can have a very short but significant increase in your eye pressure while you're doing these activities. They tend to be a higher increase during the activity. You still have a drop in pressure immediately after. But for weight training specifically, it turns out breath, your breathing pattern really matters. So in patients who would hold their breath or perform what's called a Valsalva maneuver and really bear down, they had a much higher pronounced IOP rise compared to patients who maintain normal breathing as much as possible. So if you engage in weight training, weightlifting, it's important to remember you should try and maintain normal breathing as much as you can during these activities. Swimming is another one, not only because of the increase you can have because of the activity itself, you still have that drop in pressure over long term. It's a great activity to engage in, but you have to wear goggles, or a lot of people wear goggles during this. And these can increase pressure a little bit more, a few more points while you're wearing them. It kind of depends on how they fit. I usually advise my patients to get a goggle that fits more around the orbital rim and isn't too small where it's pushing a little more on the eye. But again, even though it may increase pressure a little bit, you have a nice pronounced decrease for 30 minutes to 2 hours after the activity. One study looked at, perhaps because they wear goggles so much, there might be an increased risk of glaucoma in swimmers. This wasn't the case. I still think this is a great activity to engage in, just keeping those in mind. Yoga is another activity. I practice in Denver, Colorado. I have a lot of my patients who love yoga, some that are even instructors in yoga. This always comes up because we do know that some positions, particularly where your head is inverted or headstand positions, you can have up to a 2-fold increase in your eye pressure during these activities. Other positions like downward dog, anything where your head is dependent or below your heart can raise your eye pressure. Again, it's usually very short-lived, and you do get a reduction in IOP over the long term by engaging in physical exercise. But I advise patients, especially the ones that have more moderate to severe glaucoma, you should probably try and minimize or avoid those long head down positions. If you're in those positions, keep it to a minimum and try and avoid the full inversions where you're standing on your head. This is from my partner, Dr. Ertel, who practices in Boulder. This is from one of her patients who was a big yogi and had an eye care home, which is a way to measure your pressure at home. And he was adamant that he didn't think that these positions would raise his pressure. And so he took that home pressure monitor home, and with the help of his wife, he documented each of these positions, a lot of which I don't understand. Some of you on the call probably know exactly what these are. But he documented his pressures and how he performed these positions. And you could see there actually wasn't too much of a change in pressure. They stayed between 10 and 15 for most of these activities. But I think this highlights the fact that people who are very experienced can probably do these more safely than people who don't do it very often. And on an individual basis, we don't really know. But across the board, most people will have an increase when their head is down for a long period of time. So I think yoga in general is a great activity. Just particularly, you might want to minimize how much time you spend with your head dependent below your heart. Acupuncture, this is another thing that has a lot of purported health claims, some of which include that it can reduce your eye pressure, it can improve vision, it can also improve blood flow to your optic nerve, which we all know would be a good thing. These are based on very small studies, both in animals and humans. The best two studies, though, that have actually looked at how acupuncture can affect glaucoma were two randomized control studies where patients either were randomized to having acupuncture twice a day or to as a control group where they continued on what they were doing. And the first study found that doing acupuncture twice a day for 4 weeks lowered their pressure only about 2.5 points. But as soon as they stopped it, the effect went away. So there was no durable effect from this. And the second study, again, this is a very small study, only 11 patients. They performed acupuncture over 12 sessions. They actually found that the pressure went up a little bit after these sessions, and there was no improvement long-term over eye pressure, their visual fields, their optic nerves didn't change. So in summary here for acupuncture, I don't think for glaucoma that it's worth your time or money. I understand other health benefits, but I don't think if you're doing this solely for glaucoma, there's any evidence that it's going to help, and even some suggestion that it might be detrimental. Caffeine, this is a big one. This is something that I can't live without. So many of you probably can't live without, and we get asked about this a lot. So 1 cup of coffee on average has about 150 milligrams of caffeine, which we know can increase your pressure a very small amount, only about 1 to 2 points, and it lasts for a short period, about 1 to 2 hours. But it also increases your blood flow to the optic nerve, which is a good thing. So there's kind of a balancing there by providing more blood flow to the optic nerve with a small increase in the eye pressure. Now, 2 very large studies, population-based studies, both in the US and the UK, found no association between caffeine use and glaucoma. Another prospective study, so they followed these people over time, over 100,000 patients, found that caffeine use was not associated in any way with glaucoma. The only group that found a very borderline relationship was in those heavy drinkers, so over 5 cups of coffee a day over a short period had a slight increased risk in glaucoma. And I'm fully aware of all the other health benefits of caffeine. So I think coffee, like most things in moderation, is probably fine. Just avoid those very high volumes over a short period of time. Smoking, this is kind of an easy one. This won't be a surprise to many people, but most of the active compounds from smoking are toxic to ocular tissues or eye tissues, just like they are to your lungs and the rest of your body. Although, despite that, there's been multiple large population studies that haven't really found a link between smoking and glaucoma, while others, like the nurses survey, this is that US Enhanced survey, found that patients who were heavy smokers had a 70% greater risk of developing glaucoma. They also found that heavy smoking had a greater risk of their glaucoma progressing or worsening over time, and that stopping smoking was actually protective or prevented progression in a lot of cases. And when you combine this with the overwhelming evidence that there's a negative impact on your overall health from smoking, I think it's easy to recommend if you're a smoker, you should just seriously look at cessation and avoid it if you're not already. Not a habit you want to pick up. With regard to alcohol now, again, several large population studies have looked at this relationship between alcohol and glaucoma. There was one of them that found that heavy drinkers or heavy alcohol use was associated with having thinner optic nerves, which we know glaucoma can cause thinning optic nerves. One large study out of UK also found that regular drinkers had a slightly higher eye pressure and a little thinner optic nerves, but by far and away, most studies haven't found any real link between alcohol and glaucoma. So I lump this with caffeine and coffee use, that alcohol in moderation is likely okay, but you don't want to fall into that heavy drinker category, because there is a potential for a little more risk of worsening your glaucoma there. Sleep. We spend a third or better of our life sleeping, and we know that eye pressure goes up overnight. This is mostly due to the fact that we're laying flat, and whenever that happens, there's an increase of blood flow to the whole top half of your body, and the eye is certainly falling into that category, and it creates sort of a back pressure which increases your eye pressure overnight. Now, that blood flow also increases to counteract that, and so it's a normal physiologic thing, but some people have a big increase in eye pressure at night. A few categories, we know that people who sleep on their side, they have a preferred side. They tend to have a higher eye pressure on the dependent side. So if your left eye is closer to the pillow, that has about a 2 or 3 point higher pressure than the eye that's non-dependent or higher, further away from the pillow. And they also found that in the majority of patients who prefer to sleep on one side, the side that was dependent or closer to the pillow tended to have worse glaucoma. We also know when you sleep face down, so your face more into the pillow, that can raise your eye pressure a significant amount. So how can we combat this? Well, I think a couple things. If you have very asymmetric glaucoma that's really worse on, say, your left side, and you like to sleep on that left side, it might benefit you to spend a little more time laying on your back or on the other side, rotating around a little bit. Try not to put so much pressure on the worse glaucoma side. We also know that raising the head of the bed a little bit can decrease your eye pressure. Not a huge amount, 1 to 2 points in millimeters of mercury. I don't recommend this to a lot of patients, but for patients who were worried that pressure may be spiking at night, this can be one way to do that, either with a mechanical bed, or they have wedges that you can purchase that will raise the head of the bed slightly, and this can potentially be a benefit overnight. But unfortunately, there's not a lot of studies showing how changing these sleep positions will affect your glaucoma. So I don't have any evidence to say that doing these things are going to dramatically improve or detract from your glaucoma. These are just trends that we see. So, but if you have very severe, if your glaucoma is getting worse, despite maybe having good pressures in clinic, these are the times where we kind of think about these things, and you might want to consider and talk with your doctor about it. Sleep apnea or obstructive sleep apnea. There's been a lot of talk about this for over the past 20 years, really since we've been treating sleep apnea, about the relationship between glaucoma and sleep apnea. Most of these studies have found conflicting results. Some showed a relationship, others showed no relationship at all. But we know that treating sleep apnea can have a big benefit to your quality of life. It can have other significant health benefits. So I think if there's any suspicion to it, just for your overall health and possibly to help your glaucoma, you should screen for it. And if you have it, you should treat it. Marijuana and glaucoma. This is one that, I've been asked about as long as I've been in the field. Everyone seems to know that marijuana could potentially help your glaucoma. It gets joked about in movies a lot. And this is based on pretty old data. So back in the 70s, there was one study that showed that after inhalation of marijuana, there was about a 25% reduction in eye pressure, but only for about an hour after consuming this. Another one 4 years later found a moderate reduction in pressure, but again, the effect was totally lost after 4 hours. We don't really understand why this happens or how it's exerting this effect. It just hasn't been studied that well. There's been no link to glaucoma or decreased glaucoma in marijuana users, and there's really no great clinical trials to show how it can improve glaucoma over the long term. And because its effect is so short, you'd have to use it over 6 times a day to have a consistent pressure reduction that we want. And we also know that the more you use it, the less effect that it has on eye pressure. And you combine this with the fact that there's tons of different side effects. It's no surprise that the American Glaucoma Society has come out and said that this is not a viable treatment. Although it can lower IOP, it can lower eye pressure, it's such a short duration of action, and the side effects are so significant, they recommend against using this as any kind of glaucoma treatment. We actually did a study in Colorado, one of the first states to legalize marijuana, both for recreational and medicinal use. And we surveyed patients, we surveyed glaucoma specialists, and we surveyed dispensaries. We called them. My fellow worked with me on this project, and we called over 200 dispensaries to see what people's perceptions were. And from patients, we found that the majority of patients are aware of marijuana as a potential treatment for glaucoma, but very few are using it, which I was glad to see, only about 3%. For glaucoma specialists, very few recommended marijuana, only 7%. And of these 7%, most of them were on very specific scenarios where they had failed other treatments. And for dispensaries, the majority of these that we called actually did recommend marijuana, not surprisingly, to help treat their glaucoma. This was actually an interesting study. Some of the comments we got were pretty outlandish from these dispensaries, and it was very random as to how they recommended we take it versus smoking versus tinctures or orally, and it varied dramatically. And the concerning thing was when we asked if we should talk to our doctor about it, we were posing as a patient. Most of them said, you don't need to talk to your doctor about it. So this really kind of raised an alarm bell for me that, hey, you have to be careful in who you're talking to. This is a conversation you should always have with whoever's treating your glaucoma, your physician, and not just get your information from the dispensaries. So in short, pass on grass for glaucoma. Mindfulness and meditation. So stress is, as we know, is linked to a lot of different physiologic illnesses, and it's been linked with worsening glaucoma. It's been linked with higher eye pressures and thinner optic nerves. Two studies from Tanuj Dada and his colleagues really kind of dove into this. They did 2 randomized control trials of using mindfulness meditation on a very regimented basis for an hour a day to see what its impact would be on patients with glaucoma. And it was pretty pronounced. They found a significant reduction in pressure, 5 to 6 points. That's pretty good. There's a lot of drops that can't lower pressure that well. It also, though, decreases stress biomarkers. So cortisol, your own inherent body's production of steroids, other pro-inflammatory things were decreased. It also changed how the genes in our body were expressed. So those pro-inflammatory things that caused inflammation, those genes were turned off a bit, and neuroprotective or genes that were known to protect our optic nerve were actually increased. So the benefits went beyond just lowering your eye pressure. It changed how the body's whole response was for the better. There was also a recent meta-analysis that combined 12 different studies looking at mindfulness, meditation, autonomic relaxation exercise, and how they impacted glaucoma. And the summary was that they all generated a significant lowering of eye pressure. And I think by itself, that's worth doing. But the other benefits of reducing stress overall, I think, is beneficial. So I think this is good for anyone at any stage of glaucoma. What about diet? What should we be eating? I get asked this a lot. For antioxidants like A, C, E, one study found that a higher intake in fruits and vegetables that had high amounts of these had a lower likelihood of glaucoma. But other studies that actually supplemented with these same antioxidant vitamins had no alteration in their risk of glaucoma. And one randomized control study using antioxidant supplements compared to a control found that there was no benefit to taking them. So I think eating a well-balanced diet in these is good, but there's not any evidence that you should supplement. For nitrates, we know that nitrates can help open up some of the drainage canals in the eye, and so diets that are high in nitrates with those green leafy vegetables have been linked to a lower glaucoma risk. One study for iron and calcium found that the more you consumed of iron and calcium, the lower your risk. But then another study followed up on that and said, well, why don't we supplement with iron and calcium? And they actually found that it increased glaucoma risk. So again, these are some of the contradictory studies we see. The same thing for omega fatty acids. Some people use these to help with dry eye, and that's been shown to be beneficial. One study found that those who consumed more omega-3 fatty acids had a lower risk of glaucoma, but another randomized control trial, again, trying to deliver this in a controlled fashion, found that there was no benefit to taking these supplements over 2 years. So I think, in summary, my advice here is, eat a well-balanced diet, high in antioxidants, high in nitrates, but there's no evidence that you need to take any type of vitamin supplements to help your glaucoma. Now, herbal supplements, there's a few that have been studied, and I want to touch on 3 of these. The first one is ginkgo biloba. This has had evidence in mice studies and animal studies that it can protect the optic nerve. It has antioxidant properties, and it can improve blood flow to the eyes, particularly to the optic nerve, which we know can be beneficial. 2 studies actually found that it did improve the overall performance on visual field testing, although one study found no benefit at all. But this is certainly something to consider. The other supplement that's been studied, probably the second most, is bilberry extract. Again, another antioxidant, has been shown to improve blood flow throughout the body, but also to the eye. One study found that it could also lower intraocular pressure to a very small degree. Another study that found that after taking it for 2 years, they were able to measure and document an improvement of blood flow to the optic nerve. And that also the decline in visual field was also slowed by taking this supplement. And a third study found some improvement overall. So not only just a slowing, but an actual improvement in visual field performance. So again, there's some variable results here, but both of these, I think, are worth considering, particularly in those cases where we know your eye pressure is as low as it can be, but we may still see some progression. These are times where you should consider maybe taking one of these supplements as another way of protecting your optic nerve from damage. And then the last one I'll touch on is nicotinamide, and this is probably the one I'm most excited about now, the one that has been getting the most attention as well. This is basically vitamin B3. It's a form of vitamin B3, and if anybody's a former biology major or has some experience or remembers the Krebs cycle and how a cell generates energy, nicotinamide is one of the key components that goes into this cell's ability to produce the energy it needs to do its daily activities. And we know that in mice models, so mice that had diets where they got very low levels of nicotinamide, they had a much higher risk of glaucoma. Another study found that in glaucoma patients, their nicotinamide levels were overall lower compared to those who didn't have glaucoma. Another study in mice found that by supplementing their diet with oral nicotinamide, that they had decreased loss of their optic nerve over time, and these are in optic nerve crush models where they actually try and simulate optic nerve damage, and nicotinamide was protective against that optic nerve loss after the injury. And they found that diets rich in vitamin B3 or nicotinamide also had, where they tested different forms of the nerve function, it overall performed better in the mice who had diets that were high in vitamin B3. So in humans now, particularly in glaucoma patients, there's been two good randomized control trials that have looked at this. The first one supplemented with nicotinamide, you can see 3,000 milligrams per day. In one group, the other group got placebo for about 3 months. And you can see in the nicotinamide group, they had more improvements on their visual field and less decline in their visual field. There's other measures where they test the retina function overall, and there was more improvements in that group. But there was no impact on the overall visual acuity, so their ability to see the eye chart and their eye pressure was the same, but it seemed to protect and maybe even improve their visual field somewhat. And in the second study, again, with nicotinamide also combined with pyruvate in this case, again, they split it into 2 groups. You either got placebo or you got nicotinamide now for 2 months. The nicotinamide group found that there was a more improvement in their visual field overall compared to placebo, which had very little to none. And they also had a slower rate of progression or less worsening of their glaucoma over time. It's a very safe thing to take. The only real adverse effect that patients have noticed is maybe a mild GI discomfort, a little nausea in a minority of patients, and it's really with the higher doses. So if you're going to try this, I usually will start out at a lower dose, make sure you don't get any of that, and then try and work your way up to 1,500 milligrams twice a day. But I think the thing that really displays the interest behind the potential effects of nicotinamide are the fact if you go to clinicaltrials.gov, there's 8 different clinical studies on this for glaucoma going on, and this is worldwide. This is not only in the U.S. but across the globe. And so I think we're going to find out more about what the long-term effects of this can be. Does it have a protective effect or even an improvement that it can affect for us over the long term? And so I think we're going to find out a lot more about that, but the preliminary evidence is very positive. And the fact that it's something that's in our diet already and very little side effects or downside, I think you can consider this for any patient who's interested, especially, again, if your pressure's already very low, but you have advanced glaucoma and we're trying to do everything we can to perhaps improve your visual field function, but at least protect it even another level. I think this is a good one to consider. So I'm going to summarize each of these. I like to lump things into categories. So the first categories are things that are good for everybody. First one would be regular aerobic exercise, 3 to 5 times per week, eating a healthy, well-balanced diet, again, high in those green leafy vegetables and nitrates or high in antioxidants. Stop or avoid smoking, and consider doing daily meditation or mindfulness practice, whatever form of this that you enjoy most. The second category, I title it might help. So things that there's some evidence that it can be a benefit, but there's no conclusive things. So I think caffeine and alcohol, again, in moderation, I think are fine. Just avoid those extreme levels of use. For activity modifications, try and minimize the amount of time you spend in head down positions for yoga. If you're a weightlifter, try and perform normal breathing as much as possible and avoid straining or that Valsalva maneuver. For sleeping, if you have very asymmetric glaucoma, it's worse on one side. Try and avoid sleeping on that side quite as often and avoid that face down position. If possible, consider also elevating the head of the bed a little bit with a wedge or with lifting. And if you have sleep apnea or your partner is telling you that you snore, I would screen for it, and if you have it, treat it. And then if you're considering a supplement, I think nicotinamide would be the first one that I would consider, but ginkgo biloba and bilberry may also be beneficial more at protecting your optic nerve beyond what, say, lowering eye pressure can do. But we still need more long-term data on that. And then for things I would say, don't waste your time, acupuncture, marijuana, multivitamins. Now, these are fine things for other reasons, but for taking it solely for the use of glaucoma, I would say don't waste your time with that. So I hope this was helpful. I look forward to the next 2 speakers and to answering any questions that you have. Thank you very much.
Thank you, Dr. Seibold, and that was great. Thank you to everyone who submitted questions, and a special thanks to our panelists, Jerrold and Alice, for joining us. Jerrold and Alice, can you please start us off by introducing yourselves and telling us a little bit about your journey with glaucoma?
Sure. Alice, you want to go first?
Okay, I will. Hello, everyone. I'm Alice Burnett, and I am a retired school library media specialist. I was diagnosed with glaucoma in my early 30s. I found out by just a regular eye exam. I have worn glasses since I was in high school, and I had one of those types of vision that my diagnosis was that there was very little change in my my lens. So I had gotten into the habit of, well, it's very little change all the time when I go to the doctor. And so just change the frame out. And so I had fallen into that kind of pattern. And it wasn't until one day I decided to just said, oh, let me go and have a complete eye exam. Let me just go for the whole 9 yards. And I did. That's when my glaucoma was discovered. Um, when my glaucoma was discovered, it was pretty severe at an early age. So it led me to having a surgery right away. I did not know. I knew about glaucoma, but not that much about it. Nobody ever talked about it in my family. And I think that's one of the things that I feel real passionate about. When my doctor said, well, somebody in your family has it, I was like, oh, no one in my family has it. I went home and started talking to my parents about it. And my father said, oh, I have glaucoma. I've been taking eye drops for years. He never said anything. And so one of my passions is that we have to learn how to share. Um, in families what's going on. Our parents tend to keep things from us as not as a secret, just protecting us as children. But it's some things don't protect us. We need to know. Um, I have two children, and they know exactly what I have, and they're checked constantly. So that's one of my passions about it. I retired. I made a decision to retire after 37 years. I know I don't have to. I'm partially sighted. I've lost my peripheral vision, my depth perception. Um, I can see some faces, color is gone, some color is gone. Um, so it started to manifest very quickly. That's why I made the decision to retire. And I felt like it was okay. I know people that have vision loss can fully work. But because it had come on, the loss was coming on so quickly, I made the decision that I needed time to focus on myself. I feel that I felt if I couldn't give 100% to my job, I needed to pull back. So that's why I made the decision to retire. I voluntarily stopped driving. I no longer drive. I take disability transportation or I use family members. So that's kind of where I'm at and just learning my way around now. Because one of the things that um, and I really enjoyed the doctor's presentation because one of the things that happened to me was I retired, I went home and I sat down and could not figure out what to do. And I said, I cannot do this. This is what I cannot do is go home and sit down. So I had to make a decision to rediscover um, things to do and what I can do, what I cannot do safely, and slowly put things back into my life. And so that's where my journey is now, putting in things in my life that keep me active in this journey.
Thank you for sharing, Alice.
Hi everybody, I'm Jerrold Keilson. I just had a somewhat different set of experiences. I started wearing glasses, I think, when I was in fourth grade, and so was always going to the eye doctor to have my glasses checked and so on and so forth. I was slightly colorblind, um, and probably I knew about glaucoma, but I was, every year I was checked. My pressure was fine. My vision was fine. In my mid 50s, I came back from a skiing trip and woke up the next morning and couldn't see out of one eye. I was having retinal bleeders. Um, so immediately went to the doctor. Um, Honestly, they never quite figured out what caused the bleeders or and they cleared up after a few days, but my pressure was really high. And so I was immediately put on drops. I was at that point, I was aware of glaucoma. My mother-in-law had glaucoma, so I had been, we were trying to help her go to eye doctors and manage it. She was constantly depressed about it. Um, I had my whole life been very active. I was a marathon runner. I went to gym. I lifted weights. I learned how to breathe correctly while lifting weights. Um, and bicycled extensively. I used to do run marathons and do bicycle centuries to raise money for Leukemia and Lymphoma Society because my father-in-law had died of a type of leukemia. And so I just, frankly, just continued to do those things. Um, I was not, I wasn't losing my vision fast enough to make me stop. Um, and so that's been almost 20 years. I haven't quite figured out how to retire. Um, I uh, have continued I mean, exercising was part of my life for 50 some odd years, so I just keep on doing it. We eat healthy, so a lot of the things that Dr. Seibold mentioned about leafy green vegetables and a good balanced diet, we've always followed. Um, as Alice indicated, it's really important, though, to talk to family members about glaucoma. So when I raised the issue with my siblings, turns out my brother also has glaucoma and never would have gone to check, except that I told him he had to. And our kids are also very aware of the need to go to the eye doctor very regularly. Um, these days, my vision has been complicated a little bit by other issues, some retina issues, um, and the glaucoma seems to be reasonably under control. Um, I have some blind spots, but now I have double vision. Um, so I have to wear special glasses for that. Uh, yeah, I'll stop now.
Thank you, Jerrold. We have quite a few questions, so I'm gonna jump right in. How does exercise, particularly yoga and weightlifting, affect glaucoma? This question is for our doctor, Dr. Leo.
Yeah, that's a great question. I think as I touched on on the presentation, I think aerobic exercise has a lot of good benefits, not only systemically for your whole body, but also in lowering your eye pressure over the long term. And certainly is a great thing to engage in or continue if you already are, or I would encourage you to engage in unless there's some other health reason not to. But that can definitely be of benefit. Things like weightlifting, I think you said particularly, and yoga. With weightlifting and yoga, those real, I have a few patients who are power lifters who are doing, extreme amounts of lifting. They have a more pronounced increase in pressure. So we don't know the long-term effects of that, but it does give me some caution. But the one study on that did find that the more trying to maintain a very normal breathing pattern certainly will minimize or mitigate how much of an increase in pressure you have during lifting. So I haven't ever discouraged someone from doing, but I would encourage try and avoid holding your breath, really bearing down, try and maintain normal breathing as much as possible. And then for yoga, again, a great activity, but because your eye pressure can go up when you're in a head down position for a long period of time, try and minimize those head down positions. Or avoid them if you can, if you can still get the benefits and that you're looking for without them. that's perfect. If you still feel like you need to do some downward dog, just try and minimize the time that you do there. And with all of these things, talk with your doctor, because everyone's scenario is so unique that these are broad sort of recommendations, but everybody's situation is certainly unique. Whether you've had surgery, you're on drops, you've had laser, so talk to your doctor. That's the one thing I don't know that I touched on, but I just want to emphasize even more. So talk to your doctor about your individual situation and whether these things would be worthwhile, if they're safe to you, or maybe a benefit or not.
Thank you for that. Jerrold and Alice, do you currently engage in any aerobic exercises? And if so, any tips for other glaucoma patients?
I do. I said I needed to get active again, and that was one of the first things I did. I went around, my son took me to several different gyms, and we looked at all of them and talked to the coordinators there that, I'm a low vision patient, and selected a gym. I go to the gym every day. The activities I participate in is I take private swim lessons. And doctor, as you said, I use the larger face goggles. I don't use the tight ones that fit directly around your eyes. I use the larger ones. So I take private swim lessons. I participate in a lot of the aqua classes, such as aqua Zumba, aqua sculpt, water exercise classes. I participate in walking class. They have walking class there, which is done right in a studio classroom. She does at least 3 miles in 55 minutes. And I do that twice a week. So those are things that I do to keep active. I go to the gym every day. Mhm.
Okay. So I bicycle a lot. I have a stationary bicycle behind me. I also belong to a gym. I do both lightweight lifting for the cardio benefit and heavyweight lifting for different purposes to build muscle and bone density, which is important. And we walk. My wife and I walk pretty much every day, except when it's freezing cold out. And when it's warmer, well, I used to run, but I can't do that quite anymore.
Thank you for that. Another question here. How significant is the role of stress in glaucoma progression?
Yeah, good question. I think it is significant. It's a hard thing to measure, though. It's a hard thing to study, because everybody's situation is so unique, and your stress level from one day to the next can be dramatically different from one person to the next. I can tell you anecdotally in seeing patients that, if they've gone through a significant life stressor, maybe a death of a family member or a big injury, that I have seen increases in eye pressure over that period. And when the stressor goes away, their pressures tend to do better. So I think there's an immediate impact, and chronic stressors probably has a more long-term impact of raising your eye pressure. Now, how does it affect your glaucoma over time? We don't really know the answer to that. I think stress can raise things like those pro-inflammatory things in your body, and can decrease the things that help protect your optic nerve. So it makes sense that stress is probably not a good thing over the long term in glaucoma, and anything you can do to reduce it, whether that's meditation, mindfulness, yoga, whatever reduces your stress level, and everybody's unique there, I would say make it a point to make that part of your daily practice. Just like you may take your eye drops every day, focus on reducing your stress every day, whatever that may be, prayer, meditation, yoga. I think it's important, and if it doesn't help your glaucoma, it's certainly going to help your overall mindset. So there's very little downside to trying to reduce your stress as much as possible.
We have a question here about nicotinamide. Nicotinamide is intriguing, but what do we make of the 2024 finding of a drug-induced liver injury during a glaucoma trial?
Yeah, I don't know the details of that. That's a good point. The most common thing that we've seen in those trials is, like I said, GI upset, nausea. So when I have patients who are interested in taking it, we usually recommend they start out on a lower dose, like 500 milligrams, once in the morning, once at night. And most of those two trials use 3,000 milligrams a day. So you can work up to 1,500 milligrams once in the morning, once in the evening. So I don't know the specifics of that particular thing. Everything has some level of risk, and that's again why you should talk with your doctor about it. That's certainly a concerning finding, but I'm not aware of any other significant downsides with that particular supplement.
Thank you. We have a question here for Jerrold. Any tips for patients interested in starting weightlifting?
Sure. So a couple of things I would say to begin that you should actually get a personal trainer or somebody who can show you how to lift weights, because if you do it wrong, you can really hurt yourself. It has nothing to do with glaucoma. It's just generally form is really, really important. You could hurt your back, you can pull a muscle. So find somebody at a gym who can help you, guide you through the form. It's also important not to focus on one set of muscles. So, a lot of people always work on biceps, triceps, because in the summertime at the beach, you have good muscles, you show them off. But you want to work on your entire body. Muscles are pulleys, and so if you're pushing something, you have to pull something. Start with lower weights, take time to build up to, well, depending on what your desire is, you can build to higher weights, or you can keep lower weights, higher reps, higher repetitions, and that will promote a different kind of strength and endurance, um, which is which is equally beneficial. And as Dr. Seibold said, there's a whole process around breathing when you lift weights. You breathe out on the exertion, and you breathe in as you prepare to do the exertion or to do the exercise. So paying attention and listening to your instructor or trainer, not only in proper form but in proper breathing technique, will be really helpful. Thanks.
Yeah, thank you. I actually do CrossFit myself, and breathing is probably the hardest part of it all. We have a question here for Alice. How can one improve or better live with impaired depth perception? Alice, you mentioned you have experienced impaired depth perception since your diagnosis. Any tips?
Yes, I count a lot. I do use a cane, um, because with impaired depth perception, all stairs to me look flat. So I will just keep walking. So I do use a cane, especially if I'm unfamiliar with where I'm at and if there are stairs or not. Um, and I make sure that if I encounter stairs, I'm always counting, so I know if I'm going down or up. Um, I know exactly how many. So if I have to come back that same direction, I know how many steps there are. So I use, like the counting method, and then um, my white cane to see how far I am from the stairs and the step. I I try to find elevators if a building has an elevator. I never use escalators. They're too dangerous. And I always look to see or ask if there's a handrail first. And I definitely use the handrail to go up and down. Because I live in a two-story home also. So I make sure that, I have rails in my home also because, I have it's 2 stories and I have a basement. So I have the rails all in my home also. So I use the rails. Mhm.
Thank you, Alice. Jerrold, you mentioned you have double vision. Any tips on that?
Avoid it if at all possible. Um, the double vision is a result of a retina surgery and the implantation of a Ahmed shunt to address glaucoma. Um, Currently, I have a glass that has a prism lens, which kind of helps, and I do focusing exercises as well to help me to train my brain to ignore the double image. It's a slow process. It'll either get better or it won't, but I assume it will. Which is maybe another tip about everything in general is, um, there again, when Dr. Seibold was talking about the mindfulness and meditation, there's clearly, or I believe there's a mind-body connection to most illnesses. And your attitude towards any kind of disease can play a major role in the progression of the disease, in your coping mechanism with the disease, in how you figure out strategies, and your resilience. Um, if you get depressed, I mean, getting depressed is a normal thing that happens to people. But if you quickly, when you have a new illness or disease, but when you get over that, um, or if you can get over that and be positive and figure out strategies to deal with it or strategies to overcome it. So it was striking to me as well when Alice was saying she counts steps. Um, my father, who had a different eye issue, memorized his apartment. So he knew exactly where everything was. And he always would put things in the same place and made us, when we would visit, put things in the same place. So even though he couldn't see much, he was able to know where things were. Um, it's that kind of resilient attitude of overcoming whatever the issue is that I think goes a long way towards having a full and fulfilling life.
Thank you for sharing. We do have,
Brizette, can I just say also with
of course.
the doctor's comment on meditation, one thing that I do try to do because it was recommendation from my glaucoma specialist is that I rest during the day. So I do try to take a 20-minute rest break at some point during the day, and that goes along with mindfulness and meditation. It's just taking that 20 minutes to sit down, close my eyes, and rest.
Thank you. We do have some questions here regarding life outlook and depression. So this is for both Jerrold and Alice. Do you feel worried or fearful because of your glaucoma? And if so, how do you manage that so you can live a joyful and fulfilling life? Jerrold, you touched upon that a little bit just now.
Um, so, um, I, yeah, I mean, when I was first diagnosed, I was pretty bummed out, probably for about 4 days. But honestly, they also thought I may have had a stroke, which I knew I didn't have. But anyway, until it became clear what it was a little depressing. I have a, I hate to say this, I have a good attitude. I mean, um, there's been so much progress over the last 10 years and 5 years in understanding the causes and treatments for glaucoma and working for a cure for glaucoma and trying to regrow optic nerves or any kind of nerve, um, that I'm fully expecting that in by my 80th birthday, um, I'll be able to grow a new optic nerve. And that may be a pie in the sky attitude, but I think it could certainly happen. And so I just tend to be upbeat about things. It's a personality quirk.
Alice, any suggestions?
I try to keep a positive attitude. I cannot say that I was ever drastically afraid of the diagnosis. You know, everyone has worries and fears when they get a diagnosis that one, they know that there's no cure for, and that there's a great possibility of it going in a certain direction. But I have an attitude in life that nothing is promised to any of us. We don't know what we will encounter in life. So I keep an attitude of prayer and an attitude of hope, um, and that I know that research is being done, whether or not it will be done early enough in for me to have taken advantage of it. I'm not sure, but someone will. So I keep a positive attitude because I think we have to learn how to enjoy every day of our life, no matter what we're given. We have to enjoy every day and try and find something. Every day is not going to be happy, but try and find something positive and creative in that day. So that's the attitude I choose to take.
Thank you both. Those are awesome outlooks on life. Leo, do you have any lifestyle suggestions for normal tension patients? Is there anything you can do to raise blood pressure and improve blood flow to the eyes?
Um, Raising blood pressure is a tricky one. We have so many medications and ways of lowering eye pressure or lowering blood pressure. We've spent a lot of effort. We know the long-term downsides of high blood pressure, but we know particularly for normal tension glaucoma, there's been a link with progressing normal tension glaucoma and low blood pressure, particularly at night. Some patients tend to have what we call dippers, where their blood pressure dips really low in the overnight period. And we need a certain amount of blood pressure, right, to perfuse, to bring blood to the optic nerve and give it the nutrients that it needs to perform well. And so there is some concern, and some studies have shown that having low blood pressure, particularly at night, or what we call nocturnal hypotension, low blood pressure at night, can be detrimental. So I think there's a couple things that you can do if obviously we want to lower eye pressure as much as we can and maybe take therapies. There's certain eye drops that work better in the overnight period to counteract that by lowering your eye pressure, because it's a balance between eye pressure on one side and blood pressure on the other. And the other thing you can do is talk with your primary care doctor or whoever's managing your blood pressure. A lot of times when I see this, it's because they're on blood pressure medicine and they may be taking it at night. And so the maximal effect is overnight. And so it's dropping their blood pressure a little bit too low, whereas during the day it's fine. And the only way to really find that out is by doing like a 24-hour monitor of your blood pressure. They do make, just like Holter monitors can monitor your heart rate, You can do a 24-hour blood pressure monitor, or you can just get a monitor from Amazon or from your drugstore and just check your pressure occasionally at night to see, is it getting low. And as I said, the most common reason is either you're maybe being too aggressively treated for high blood pressure, or you're taking the blood pressure medicines at a time where it's dropping your blood pressure too low at night. And so for those situations, working with your primary care doctor, sometimes we can shift the dosing to where you take those medications in the morning, or maybe back off the medication a little bit. If you really want to find out more, getting a home monitor and checking it in those periods in the overnight period. But it is important, and it has been linked, particularly in normal tension glaucoma, to possibly worsening the disease. So it's another thing to keep in mind.
Thank you. We have a question here for Jerrold. You mentioned you hike, or actually, do you hike? And if so, what modifications do you suggest? Have you found any tips to doing it safely?
I do hike. I've in the past year or so, I've started using hiking poles, like walking poles, and that seems to work. Um, that's really the only modification that I've had to do. I have found, I think that like snowshoeing, because there's no ability to really distinguish height under the snow. It's a little more challenging, and everything, because it's essentially a whiteout situation. That's more challenging, and I go slower. So back in the day, I would try and run up a trail. Now I meander up a trail. But the poles make a big difference.
Awesome. Alice, we have a question here about swimming. Any tips for someone who is interested? Do you have a professional with you at all times?
I do not have a professional with me at all times. I take swim lessons. I do have a professional instructor um, that I take swim lessons with. I've been taking swim lessons for about almost a year now. And because I told her my goal is actually to be pretty proficient and begin to in swim laps. So that's what she and I work towards. Um, so I meet with her once a week and we work on technique. And then I am on my own the rest of the week practicing the different things that she and I have gone over. And I do wear the larger goggles that the doctor talked about, because the smaller ones are too tight around your eyes and it's not good for your eye pressure. So I do wear the larger goggles. That's the change that I made in that. And I find it relaxing. I love it. Um, it's good for, your it's just a good all round activity for you. And so it's something that I really enjoy. Also, like I said, I enjoy a lot of the aqua classes that they have. So I participate in a lot of the aqua classes there at the gym. So I highly recommend swim for people with glaucoma. Whether you already know how to swim and you just stopped. With my challenges, because I completely cannot see in the dark, but I memorized the gym that I go to. So I'm not afraid to go in and get myself ready. I memorized the pool area. I know exactly where everything is. I know where all the stairs are leading in and out of the pool. I know where the showers, everything as Jerrold knows, we just do a lot of memorization. So I memorized all of that. So I'm there by myself. I go by myself and I'm not concerned about that. Um, Most of the people around me, the instructors, know that I'm a low vision person. Um, so that's not a concern. So I think part of it is it's almost like that family thing that I said about keeping it to yourself. Sometimes you have to let people know. And anything I've tried, I wanted to try at the gym that I go to, I speak to the instructor and let them know what I can and cannot do. And then I take it from there. And so swim has not been an issue, has not been a problem, and I highly recommend it.
Yeah, that's great advice. Talking with your instructor and letting them know you have glaucoma. Um,
Mhm.
we have a question here for Dr. Leo. Do you have specific dosage recommendations for the ginkgo biloba and the bilberry supplement?
Um, so for ginkgo, the dosing, it varies based on which study that you look at. For ginkgo, though, I believe it's you can go up to 120 milligrams a day. Usually, the study I'm thinking of dosed at 80 milligrams morning and night, so a total of 160 a day. Or you can do 120 milligrams daily too. Kind of depends on where you can find it and what dosage you can find it at. But again, I would talk with your doctor about this to see what they're comfortable with you taking and make sure that they know that you're taking it for this too. So that way, if you do see an effect, positive or not, they're aware of that. And if you have any sort of adverse effects from it, then you know what it did. For bilberry, the active ingredient in that is anthocyanin, and so you want to choose something that's like a 25% anthocyanin dosage. The other caution with that is that it can increase your risk of bleeding and lower blood sugar. So if you have diabetes or if you're on any blood thinners or any bleeding risk, you want to be careful with that one. And again, talk to your doctor about it. Maybe talk to your primary care to make sure they're okay with that. But anywhere from, I think, 60 to 80 milligrams of anthocyanins is what has been studied. So.
Thank you for that, Jerrold and Alice. Do either of you take any supplements for your glaucoma?
I do not.
Um, I take a AREDS formula, which is so it's a multivitamin with um, uh, that's formulated for macular, which I started taking because my father used to get on my case about it, um, and it's become a habit. I'm curious, if I could ask Dr. Seibold. I mean, I've been told that lutein is an important micronutrient for vision in general. So I'm curious about that.
Yeah, it's affecting glaucoma. It hasn't really shown to be of great benefit. So, just like with the AREDS vitamins, Preservision and Ocuvite have been really studied extensively for macular degeneration, and we know it can help slow down that disease. And it makes sense that it might help in glaucoma, but no study's ever really shown that. That those supplements are beneficial for glaucoma. We know lutein is used in the retina. It's a very high, high activity cells, and so they need that. But I don't have any data to say, hey, you should take a supplement specifically for that. There can be other reasons to take it, but it makes sense that the retina uses it. It might be helpful. I just don't know for sure.
Thank you.
Okay, so this is our last question. Does heavy computer use affect IOP? Are there any studies on this topic?
Yes, but not if you're watching a glaucoma webinar. It's actually beneficial. So, no, there's no great data that I'm aware of that heavy computer use will affect your glaucoma. Now, it will certainly affect other things that will affect your vision on a more immediate impact. in that it can add to eye strain and dry your eyes out. Anytime you're doing an activity, whether it's reading, working on a computer, watching TV, where we're very focused on something, we slow our blink rate down from, a few hundred times a minute to about 5 times a minute. And so you can imagine the drying effect that has on the surface of your eye. And so it can cause strain, it can make them more red, irritated, and the more dry they are, the worse you're going to see. And so it's okay to use those things, but I advise my patients take breaks, do it in smaller increments. And if you start to get blurry vision, if you start to have redness, if you start to get tearing, those are all signs that the eyes are getting really dry and you need to take a break, put in an artificial tear, walk around the room, stare out the window for a little bit and then come back. But take frequent breaks, use artificial tears or whatever lubricant drops your doctor recommends. And then, like with anything, in moderation, so give yourself breaks. Try not to stare at it too long because your dryness is what's really going to get worse.
So can I make a comment on that? Because I am still working and have had to figure out how to deal with that. So I have laptops are terrible because it's just too small. So I have a very large monitor that's actually a monitor designed for gaming, which I don't do, but it refreshes very quickly. So the contrast is really good. And when you're working on a document or a spreadsheet, whatever, if you blow it up to 140, 150%, that's fine. And if you work with a laptop, then you just get a docking station and put the laptop in the docking station, and you don't have to use the screen on the laptop.
Yep, great suggestion. Well, thank you all. That concludes our Q&A session. Thank you all for making the time to be with us today and for providing such helpful information to glaucoma patients and family members and their friends. Thank you once again for being with us today and for joining us in our bold vision of a future free from glaucoma. Because of your continued partnership, the cure is truly in sight. See you next time.